Hi everyone, I am Dr. D.G.S.V.D. Gajasingh, also known as Sineth Gajasingh. I am the Chief Medical Officer at Sineth Hospitals, Boralaskama. The reason for this video is, as an institution, we have decided to make few changes due to the COVID pandemic that is spreading across the world. So this pandemic has affected all our lives. Earlier, as doctors, we used to be in hospitals, in clinic rooms, seeing large number of patients. Now, I also feel better to stay in a spacious environment which is well aerated, because otherwise it's difficult to practice these COVID preventive measures. So, with this pandemic, we are facing many challenges. One is the health risk related to the disease. But apart from that, the whole world is facing an economic crisis. But not only that, if I consider about individual level, if an individual visit to a place which was visited by a COVID patient, that individual will face many difficulties and consequences based on the rules and regulations laid down by the authorities in the given area. So it's always best for all of us to have our services and needs without physically visiting the places. So online service providing is becoming a popular solution for this combat against COVID pandemic. So as an institution, we also planning to implement two new changes. One is called zero contact care. Other one is called online international care. What is this zero contact care? The zero contact care is a way of providing health services to our OPD patients via telecommunication techniques. It can be a phone call, it can be a video call using 3G or 4G technique, or it can be something like WhatsApp, Messenger, or social media associated communication. But why we should do this? It will prevent patients visiting the health institutions, especially hospitals and OPDs. Why? These are the places where we get lot of patients with minor conditions, commonly cough and cold and other respiratory symptoms. So these places carries a higher risk of spreading COVID-19 among people. But next question is, whether is this possible? Yes. To date, it's aware that more than three-quarters of OPD patients can be managed with over-the-phone consultations. Actually, this new development called as telemedicine, and it's very popular in various parts of the world. Therefore, we also planning to introduce that service from our institutions. What you have to do is go to our website, book an appointment, pay the consultation fee, and at the appointed time, one of our doctor will contact you to answer your health queries. And based on the requirement, we will send you an e-prescription, or in certain situation, we may be able to provide you with drugs which are delivered to your doorstep. But there may be certain legal issues for us when we are providing these services based on the rules and regulations laid down by COVID control mechanisms. So in this way, we can prevent our patients, especially high risk patients, visiting the hospitals and OPDs and protect them from this disease which can be lethal to such patients. Other service is online international care. So here we aim to treat our fellow citizens who are living outside our country. So it's again you can ask, is this possible? Yes, we have many problems and we will not be able to provide you with most of the drugs. But if you think back, you will realize sometimes what you want to know is whether this particular condition or the problem you are facing does need to meet a doctor. Because even the simple answer to that question can prevent you from visiting a high risk environment like hospital OPD. And sometimes you may be having a complicated disease which you need some explanation and clarifications which you have failed to find up to now. And it is known to date that about half or slightly less than that number of patients who are visiting OPD can be managed with no drugs or over the counter drugs. So, such patients can be managed via this online service. So, here is our new services through which we are planning to help the world to combat against this COVID-19 while minimizing the collateral effects or damages due to protective strategies implemented within the health system. I hope you will understand the value of these services and consult us depending on your requirement. Thank